हेलो एवरीवन, कैसे हैं आप सब। आज की वीडियो में हम डिस्कस करेंगे एक्टिव साइकिल ऑफ ब्रीदिंग टेक्निक। प्रीवियस वीडियोस में हमने पल्मोनरी सीरीज़ में एक्टिव साइकिल ऑफ ब्रीदिंग टेक्निक, ब्रीदिंग कंट्रोल, थोरेसिक एक्सपेंशन और फोर्स्ड एक्सपायरेशन टेक्निक्स ब्रीफली देखी थी। आज हम उसको कंप्लीट डिस्कस करेंगे। शुरुआत करते हैं एक्टिव साइकिल ऑफ ब्रीदिंग टेक्निक। व्हाट इज़ इट? It is described by Weber and Pryor. So definition is ACBT is airway clearance technique that consists of repeated cycle of three ventilatory phases. So the three ventilatory phases are breathing control, thoracic expansion and forced expiration technique. In short we called it FET. So exams में अगर FET आए तो आपको याद रखना है कि फुल फॉर्म क्या है, ठीक है। Goals of airway secretion clearance. So the main three goals are to reduce airway obstruction, to improve mucociliary clearance, to improve ventilation and gaseous exchange. So these are main three goals of airway secretion clearance. Number one of three ventilatory phases is breathing control. So what is breathing control? It mainly consists of the relaxed breathing at a tidal volume with emphasis on diaphragmatic and lower ribcage expansion. It means that it mainly emphasis on the diaphragm and lower ribcage expansion at the tidal volume of relaxed breathing. Okay. Number two, encourage patient to relax upper chest and shoulder until he or she is relaxed for mainly 5 to 10 seconds and ready for the next phase. It means the main important things in this breathing control technique is the patient's shoulder and upper chest should be relaxed, the breathing at tidal volume, the diaphragm and the lower ribcage will be expand, and the relaxed phase is of 5 to 10 seconds. Okay. Number two of three ventilatory phase is thoracic expansion exercise. So thoracic expansion exercise is after the breathing control. In short we called it BC. After breathing, BC का कोई और मतलब मत निकालना, ठीक है। So after breathing control, patient instructed to take deep breath to inspiratory reserve volume, and expiration is a passive and relaxed process, we know that. Chest percussion, vibration, shaking may be performed as patient exhale, ठीक है। जैसे पेशेंट एक्सहेल करेगा तब चेस्ट परकशन, वाइब्रेशन और शेकिंग हम परफॉर्म कर सकते हैं। फॉर सर्जिकल पेशेंट, एज इफ द पेशेंट इज ऑन any lung collapse disease or any other surgical condition, so a breath hold or a sniff at the end of inspiration encourages the collateral ventilation to redistribute air into the collapsed segment in re-expansion of lung. It means that when the patient is instructed to hold the breath or sniff at the end of inspiration, then it will encourage them to collaterally ventilate for the collapsed segment for re-expansion of the lungs by the redistribution of the air into that collapsed segment. So this will cause the expansion of the thoracic region. So thoracic expansion exercises will have main three things, that we have to deep breathe to the level of inspiratory reserve volume. These technique, percussion, vibration and shaking, can be performed at when the patient exhale, and for the surgical patient, breath hold and sniff at the end of inspiration will be done. Number third technique is forced expiration technique. So in short it is FET. It consists of huffing alternating with breathing control. So huffing with breathing control is forced expiration technique. So huffing can be performed in two volumes. Number one, patient perform half the medium volume huff to mobilize secretion. So first point is to mobilize secretion, patient perform half medium volume from the peripheral. So the how from where the secretion will be mobilized? From peripheral airways, followed by the period of breathing control, and then patient does a high volume huff to clear secretions that have reached larger and proximal airways. So, firstly, patient will perform half medium volume half to mobilize the secretion, and then he will perform high volume half to clear the secretions. So, the main points is first is to mobilize the secretion, and second is to secrete out the secretions, to clear the secretions. Okay, to mobilize the secretion and to clear the secretion. So these are the three ventilatory phases in which all complete airway clearance technique is done. Okay, so if you understood it, please hit the bell icon and subscribe my channel. Thank you.